flexion at the hip.
Right, because the rectus femoris crosses two joints. It's the only one that crosses the hip, so it's the only one that can do anything at the hip. Okay. And what are the other muscles that we said flex the hip? What's the main one? Is the psoas or iliopsoas, right? And then what else? It's this one right here. TFL. Right. Okay.
So you said those three flex the hip?
Yeah. The primary one being the psoas or the iliopsoas. Accessory ones are going to be rectus femoris and TFL. And then also, what about this one?
Sartorius.
Sartorius, yeah. Okay, so that's basically the anterior compartment. Starting from the ones that cross the hip, which is the iliopsoas, and then we have the quadriceps, which is the rectus femoris, vastus medialis, vastus lateralis, vastus what? Intermedius. Then we have a couple of little extra ones. The one that runs across like this, sartorius, and then this one. So it's like the pocket muscle, right where your pocket is. So now we'll move over into this compartment. So now we're talking about medial compartment. And those primarily, the first name of most of those are going to be adductors, at least the main ones. There's a couple little smaller ones that have other names, but most of them are going to be adductor, such and such. First name is going to be adductor, last name is going to be another name.
What is that line from the iliac to the?
That's the inguinal ligament. We're talking about this here?
Yeah.
Yeah. That's the inguinal ligament. So it's kind of, you know, if you can see this kind of dishes in right here. So it goes across there. And then there's different things that pass under there. The femoral artery, femoral nerve, and femoral vein. So the actual, it's soft tissue, it's a connective tissue that goes across there, so it's not bone.
So is it similar to the purple tunnel thing where it holds things under?
In a way, yeah.
That's on purpose?
Of that inguinal ligament? No. It's because if you remember when we talked about abdominal muscles, what was some of the attachment points of some of those abdominal muscles was the inguinal ligament. Okay? So those abdominal muscles are going to insert onto that inguinal ligament. And there's not really any muscles that come off the bottom of it, but what do you think would attach to that? That's connective tissue. That's like fascia. Because it's close to the surface of the outer side of the thigh, right? What's contiguous with all the way around the outside of the thigh? The fascia lata. Okay, so that fascia lata that goes all the way around the thigh is going to come right off of the inguinal ligament. Okay. So again, you know, we talked about how in certain ways fascia is kind of continuous with different things. So in this case, you have muscle that attaches to that soft tissue or the inguinal ligament, and that's continuous with the fascia down into the leg and the thigh. All right, so now we have the adductors, and those are going to be mostly medial. And like I said, the first name of most of those muscles are going to be adductor. Okay, so we'll get into those. And this thing's kind of distorted because that's why it looks kind of funny. It's more wider than it should be. So adductor magnus. The magnus is going to be the biggest one in there. Okay? And if you ever see different pictures, like if you're looking at this here, this adductor magnus is usually going to be seen here. So it's going to come off of the ischial and the pubic rami, the ischial tuberosity. So it's basically this area here. So the ischial tuberosity is back here at this bump, and then the ramus is part of the rim of it here. And then also that comes up towards the pubic bone. So it's coming off of the pubic bone and the ischial. And then it's going to go to the linea aspera, and then all the way down to this adductor tubercle, which is here. So it's not crossing the knee. If if you're coming down the medial side of your knee, you'll feel soft tissue, then all of a sudden you feel bone right there. That's the adductor tubercle. Okay? It's the most superior part of this epicondyle of the femur, the medial epicondyle. So that's where that adductor muscle is coming down this way. It's going to attach right there. So that's going to be basically this right here. So like I said, if you're feeling soft tissue coming down your leg, all of a sudden you feel bone right there. That's the adductor tubercle. So the anterior part is going to do adduction and medial rotation, and then the posterior part is going to start blending in with the hamstring. Okay? So the anterior part of it is going to do adduction and medial rotation, and then the posterior part is going to flex the knee. Or actually, no, it can't flex the knee. It's going to extend the hip because it doesn't cross the knee. So it acts with the hamstrings to extend the hip. And let's see if this one wants to start. If it works, basically it's going to show the different portions of the adductor muscles. But I've got pictures of them so we can show them. There's going to be the adductor magnus, adductor longus, adductor brevis. Because he doesn't want to talk to me. So adductor longus is going to come from the pubic ramus, so it's not so much over to the ischium like the magnus was, but it's more towards the anterior part. So it's more on the pubic symphysis, so we're moving more towards the anterior portion of the medial leg, or thigh. And then it's also going to go into the linea aspera. And so it's going to adduct and flex and then medial rotate. So it adducts, or flexes at the hip, and then medial rotate. The primary motion of the adductors is to adduct the thigh. So then there's the adductor longus, and then you have the adductor brevis, which is going to be a little bit shorter. Here. Okay? So again, it's coming around to the back side of the thigh, of the femur on that linea aspera, and it's coming more from the pubic portion here. Okay? And then we get to this one too, we have the gracilis, and then you also have the pectineus. So pectineus is going to come up from here on the pubis, and then it's going to go to the more proximal part of the thigh. So then the magnus is the one that went the farthest down. Okay, that went all the way to the adductor tubercle. And the longest goes not quite so far down, and then the pectineus is up again higher up here. Okay. And then the gracilis, this is the one muscle on the medial compartment that crosses two joints. Okay. Remember, it's part of this sargent right here. Sartorius, gracilis, and semitendinosus. And this side. Okay? So it's coming over here with the sartorius, and then the gracilis just comes straight down the medial part of the thigh right here. And then that meets up with the one from the back. This is the semitendinosus, which we haven't gotten to yet. Okay, so let's go over those again. So you have the adductor magnus, that's the biggest one. Okay, that's what magnus means. So that's going to cover all this area here. And it does have this little opening here where the vessels are going to go through. Okay, the femoral artery and nerve and vein. But then the adductor magnus goes all the way down to the adductor tubercle, which again, that's the part of the medial epicondyle of the femur. Then you have the adductor longus, and the magnus was coming from part of the ischium and part of the pubis. Now the adductor longus is mostly just going to be the pubis. And that's going to go down to that linea aspera, but a little bit higher up. So it's still relatively long, but it's not quite as long as the magnus. So it goes down about halfway down.